So yeah, just stay like this. So as I'm injecting you the medicine, it does have some numbing medicine, okay? So you'll feel more numb. So we're filling this line called Belotero. So the fillers are good for lines are Belotero, Juvederm Volbella, Restylane, one of them with silk, soft, and RHA Redensity or RHA1. That's what I need. Can bend it like this. So these fillers as well have some lidocaine in them. They're still kind of like sensitive to inject the skin, but at least we're also injecting some lidocaine as we are injecting the filler. So you know the lines will immediately look better, but part of it is from the needle and from the swelling. But the good thing as well is that with time these fillers they absorb some water, so if we very accurate in our placement, and then with the water absorption, then they'll fill these lines, and you know they'll make them look way better. They're not gonna go away 100%, but at least you know it'll make them less deep and appear better. And for our line here, that's the only place that's bothering him. This is typically not a good area for Botox, so we cannot inject Botox to fix these and to relax these lines. And it's not also cannot fill too much filler in this area, although might help as well. So we're left kind of with this. Other treatments, you know, if you there's an article on the website called Wrinkle treatment. It lists all the different things that you can do for this, from microneedling, chemical peel, retin-A, laser resurfacing. A lot of different things can help. It's a process, I would say, for this stuff. It's not one thing and then you're done. It's different things, little by little. Again, you can see it's already better. I'll just put a little bit more, and then this is good for this, and then this is, you can see the other one, this line from here. So when we finish these, if we have a little left, you know, he's here for these two main areas, we might do some areas around them as well. So I'm watching the depth, I'm staying very superficial, the direction, I'm advancing very slow, because if I just put the needle all the way in, all the length, then you know it's not as accurate placement. So that's why I advance slow in this area. There's other technique where you do perpendicular, do multiple pinches and stuff. It's the same principle where you need to stay. You see how now it's almost disappeared. The different pinches for different areas, but that actually is more painful, takes more time, and I don't think it's as accurate or there's any specific benefit to that. This technique I developed over time and experience. The other one is just you go and then you just do barely touch the skin, go a little and inject little tiny, and you go down little by little till you cover the whole area. I do use that technique sometimes just to fill in certain areas if I need to, so I use it selectively. I always say I don't like always to do or inject certain way because everyone else is doing it that way. I like to have a reason for everything that I'm doing and develop my own technique and learn from everyone. Okay, so that's good, like almost gone. This has responded really well. Let's go back, and then what I can sometimes, big smile, Francisca. Okay, yeah, that's fine. So that's actually good. I'm gonna fill some of these crow's feet area. Well, we're almost done. These lines here. Again, he's not here for this one, but why not? Another article for the lines that are lower, it's called accordion lines, the same in my website, which is beverlyhillsmedspa.com. There is an article called, in the blog section, called accordion line treatments, and it lists all the different things that you can do as well for the accordion lines. Yeah, if you have any questions, any concerns about this treatment, any other treatment, please let me know as well. You see here, I think cleaned it, but just in case. We're using certain kind of fillers for certain areas, you know, of course, we can go on and on for a long time. Why? But there's a reason for everything. And for example, for this one, the Belotero, it has very high viscosity, so in clinical settings, it means that wherever you inject it, actually it stays there, it doesn't migrate. And that's what we need when we inject very superficial lines. Tell the patient to be just very gentle for the coming few days in this area.